Every day we learn more and more about this Omicron variant, so that's where we're going to start today with some breaking news from Pfizer in the fight against the Omicron variant. The manufacturer now says that 2 doses of its existing COVID vaccine may not fully protect people against the Omicron strain, but their data shows that 3 doses had much better effectiveness. This comes after Pfizer CEO said they'll know in a few weeks if a modified vaccine is necessary, but that sticking with the current shot is preferable. Meanwhile, new data suggests that while the Omicron variant may cause less severe illness, the Delta variant is still driving case numbers and hospitalizations across the country. So Laura Podesta joins me now with the very latest on this. Laura, good morning.
Good morning, Anne-Marie. So COVID infections right now are increasing in 33 states across the country. Some have hospitals at capacity. For example, in the Minneapolis metro area, there are no more adult ICU beds available this morning, Anne-Marie. This winter surge is driving people, if they haven't already, to get the shot.
Concern over the Omicron variant is driving Americans to get vaccinated against COVID-19. 12.5 million people got a shot in the past week, the most since May.
We also have a lot of vacations planned, going to Italy, going to Hawaii, so it's like, why not? Extra layer of protection.
An early study out of South Africa shows Omicron's ability to evade the Pfizer vaccine is robust, but not complete, but that a booster shot could help stop infection.
It appears that with the cases that are seen, we are not seeing a very severe profile of disease. In fact, it might be, and I underscore might, be less severe.
Health officials say Americans should be more concerned with the Delta variant right now. Cases are rising in 33 states.
All of our hospitals are critically strained right now.
More than 95% of Wisconsin's ICU beds are in use. Froedtert Hospital President Eric Conley says most patients have one thing in common.
Unfortunately, the vast majority of our COVID-19 admissions are patients that are unvaccinated and could have prevented their need for care if they had taken action earlier during this pandemic.
Pfizer CEO told a Wall Street Journal conference the company could have a vaccine for Omicron by March if one is needed.
So, Anne-Marie, based on the information that we just heard from Pfizer, it just sounds like if you haven't gotten a booster but you are eligible, now is the time.
Yeah, I definitely say that's the case. So in the meantime, aside from vaccines, both Merck and Pfizer are working on prescription pills to actually treat COVID-19. What do we know about that so far?
So these 2 pills could prevent ICU beds from filling up because they really reduce the severity of symptoms and they reduce the need to go to the hospital, and ultimately they reduce death. Both the Merck and the Pfizer pill should be taken within 5 days of the onset of COVID-19 symptoms. The FDA is expected to authorize the Merck one first, then Pfizer by the end of the year. Anne-Marie.
Okay, we heard from Pfizer. We know how they say their vaccine works on the virus. What about, the other vaccine makers? Do we have any additional research on how their vaccines deal with the Omicron variant?
Well, regarding Moderna, Moderna's president, Dr. Stephen Hoge, said that there's a good chance that the current Moderna vaccine will not hold up as well against the Omicron variant. And Moderna's chief medical officer has come out and said that it would take about 3 months for Moderna to produce a vaccine specifically for Omicron. Johnson & Johnson, that CEO has stayed relatively quiet about Omicron, but the company's global head of research said that the variant's presence shows that drug makers must continue testing and monitoring COVID-19's mutations, and that J&J is currently testing its vaccine against Omicron. Anne-Marie.
Yeah, that makes sense. This virus is definitely keeping us on our toes. Laura Podesta, thank you.
Thanks.